why is it on the patient to do this research? To me, like, an oncologist is someone that's overseeing your care. And I don't understand, and maybe it just depends on the oncologist or what have you and how involved they are, but I hear more and more that it's on the patient to do their own exploration. For me, it should be on the oncologist to do the research and find out what you might be eligible for. They should be making the phone calls peer to peer. And so it's very confusing to me why it's on someone who is terminally ill, in this case, to find out a drug that might be applicable to them.
It comes off cynical, but this has been my experience, so I'm definitely open to pushback. But so MSK is one of these ivory tower places, and still, I think I recently saw the statistic, maybe there's 3,000 plus trials recruiting in lung cancer right now. MSK only has 300. So our oncologist at MSK was super helpful in helping us find a trial within the MSK system. They had a built-in software that would match patients to trials within MSK. But there was no system that was able to help that oncologist search for trials outside of MSK. Where I kind of have the cynicism is, I think the oncologists want to find the right trial for the patient, but if they're seeing a patient in 20 minutes and they're seeing hundreds of patients, they do not have the time or bandwidth to search for trials outside of their institution. And the institution is designed in a way to keep patients continuing to get care at that institution. So I think there's some financial incentives at play, but ultimately there's this technical barrier where searching for a clinical trial on clinicaltrials.gov can take hours. Having the engineering background, I built a platform that tries to automate as much of that search as possible. So I see the solution as patient plus oncologist, because I think there can be different aspects brought to the table by both.
We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit CrackingCancer.org to join the Cracking Cancer community.